Good evening and welcome to tonight's NATS chat on transgender singer, what voice teachers really need to know. And I'm Kari Ragan, I'm the NATS chat host, and I'm so honored to welcome my guests Sandy Hirsch, Liz Jackson Hearns, and Emerald Lessley with us tonight. I want to begin by reading a quote that I heard earlier today on a TED Talk from a gentleman called Jackson Bird, and the talk was entitled How to Talk and Listen to Transgender People. And in this, at the very end, he says, and I quote, "Amplify our voices. Take the heat off of all of us and educate people around you so we don't have to every time. Maybe someday when I say, hi, I'm Jack and I'm transgender, the only response I'll get is, hi, nice to meet you." And I thought that was so poignant today that I happened to listen to that. At the beginning of the talk, he talks about when he first introduced himself, there's a litany of questions that he knows people have on the other side of that hi. And so I love that he brought that full circle, that at the end of the day, I think we all need to amplify their voices, others' voices. And I think tonight is a great start for the singing community to continue these conversations. So I thank everybody for joining us tonight. And I'd like to start the conversation first with Sandy Hirsch, who happens to be my dear colleague here in Seattle. And she is a speech-language pathologist who has worked with the transgender community for over 25 years. Sandy, will you just share with us a little bit about your journey in arriving to this point?
Yes, hi everyone. I started working with transgender people when I was in graduate school. My first school in the clinic in 1980. And it was very much handing from a standpoint of the voice part, which has always been my passion. I'm a linguist, a singer, and was an actress, and moved around a lot as a child growing up in England and Europe, and have always understood that sense of never quite being at home anywhere, but being at home everywhere. And so that piece was quite an interesting fit as well. And I've made that a focus of my practice ever since. And so here we are, 25 plus years later.
And Sandy, you, of course, I know you're one of our preeminent speech-language pathologists in the community, especially on this topic, very nationally known. And your book, if you wouldn't mind holding your book up and sharing that with us. And tell us the title of it and when the first edition was.
Yeah, the title is Voice and Communication Therapy for the Transgender Transsexual Client, a Comprehensive Clinical Guide. And of course there's a colon in there, as there is with all of these sorts of things. The first edition came out in 2006, and it's by Adler, Hirsch, and Mordaunt. The second edition was in 2012, also Adler, Hirsch, and Mordaunt, with multiple authors contributing different chapters. And we're actually in the process of working on the third edition right now, which will be Adler, Hirsch, and Pickering. And our manuscript is due to the publisher in March, so we're thick into that right now, and hopefully be out middle of next year for purchase.
Are there a lot of takeaways in the book for the singing teacher who is going to specialize or in some way work with the transgender community?
Yes, actually, my very esteemed colleague, Anita Kozan, who is a speech-language pathologist and singer herself, I'm in the process of editing that chapter right now, and it's a mere 100 pages long. So yes, there are going to be plenty of takeaways. She wrote a chapter in the first edition and the second edition, and she's now writing a chapter, co-writing a chapter with Sandy Hammond, who I believe is also in Chicago. She's not in Chicago?
She's in Boston.
Oh, she's in Boston. I'm so sorry. That's right. That's right. So it's very, very rich. In fact, one of the comments that I made in editing the chapter the first draft that came in was, this is such a good chapter, I almost cried while I was reading it. So there's going to be a lot of wonderful information for singers and teachers, yes.
Well, let me introduce our second guest, Liz Jackson Hearns, who lives in Chicago, has a master's in music. And Liz, would you just share a little bit about your journey to this point tonight?
Sure. So I'm Liz. My pronouns are she, her, or they, them. Like Kari said, I live in Chicago. I have been teaching voice for a number of years, and I started working with trans singers about 3 years ago, pretty much by accident. One of my I don't know, a student who was studying a different instrument had started taking tea, and he had a lot of joint pain. So he decided to take voice lessons as a way to continue his music education. And he was my first, and since then have built a studio around that. And I'm the owner of the Voice Lab, and we have 6 teachers here, 5 of whom are voice teachers, and over half of our clientele are gender diverse in some way. So we work with trans singers, we work with folks who are doing some speech coaching, and we have a wide variety of students, mostly adults. In addition to that, I'm also on the board of directors, and I'm one of the co-founders of Resonate, which is Chicago's trans choir, and have recently taken over as interim choral conductor, which is hard, but it's been wonderful. And I'm working on a book called The Singing Teacher's Guide to Transgender Voices with co-author Brian Kremer. Our manuscript is due on the 31st, and we're hanging in there. And it should be out by spring or summer in 2018.
Merry Christmas to you.
Thank you.
And it's plural publishing, correct? That's published your book. And we're getting from Michelle a yay, Liz, woohoo.
Oh, thanks, Michelle.
And we'll come back to this a little bit in more detail later, Liz, but would you tell us, do the majority of your singers sing in the CCM vein, or classical, or across the board?
It's kind of across the board. I would say, I guess most of them do CCM or music theater. We do have a couple of classical singers, some budding opera singers. We had and you know, the company is so new that we're still kind of developing those programs. We did our first very unique production of Magic Flute last spring, and one of our Taminos was trans. We just did a band camp for grown-ups this last fall, and about half of the members of that program were trans. So it really varies.
Wonderful. Well, that leads us to Dr. Emerald Lessley. And in the interest of full disclosure, Emerald was my student, a doctoral student at the University of Washington, and graduated last June. And she is very graciously joining us from Germany at 3:30 in the morning. So welcome, and thank you, Emerald. Of course, I know your journey, but I remember the day, in fact, you came to me in the hall. I remember where you were, and quite a bit into the final push of your doctoral work, you said, I want to change my area of deep research, and you were nervous, I believe, to share that with me because it was so late in the game, and I knew you could do it, and I said go, 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 and you did such a wonderful job. So I would love for you to share a little bit about your work and your journey to this point.
Sure. Well, yeah, so this started, I have a very dear friend of mine who is also a singer, and we did our master's in voice together. And I was in New York and visiting some family, and ended up spending the day with him. And toward the end of the afternoon, he said, hey, I have a voice lesson. Do you want to come with me to my voice lesson? And this was right at the beginning of his transition. And I said, of course I want to come. And when I was with him, I noticed that the teacher was doing a good job. She's a good teacher, but it seemed like there was a lot of trial and error happening, that there wasn't as much, you know, that she really knew how to proceed. This was her first trans student, that kind of thing. And so it inspired me when I got home to actually look and see what is there available right now for voice teachers who are teaching trans students. And what I found was not very much. And most of it especially wasn't based in science. There wasn't a place where you can just look and find all of the information you might want kind of distilled in an easy to understand way. And I'm cisgender, but I'm a member of the LGBTQ plus community, and I have friends who are trans and colleagues who are trans, and I thought, this is something that needs to happen. I'm passionate about it. I'm a big nerd. I love the science part of it. So this is what I want to do, and so that's what I did for my dissertation. And I taught a class, a trans class, every Tuesday night for trans singers who weren't really comfortable taking private voice lessons but wanted to sing. And I also taught 13 private trans students while I was doing all my research. So it was a wonderful experience.
Seattle's a wonderful, inclusive community, wouldn't you say, by and large?
Absolutely.
And what is the title of your dissertation?
My dissertation is just simply called Teaching Transgender Singers. I wanted to keep it simple and easy to find, and it's on ProQuest right now, so if you have university library access or access to ProQuest, you should be able to find it for free.
Terrific. Well, so that leads us, thank you all for the great welcome, our introduction. I want to remind NATS chatters that this is your chat, and so we're going to launch into some conversations, but you have two ways to ask me questions. There is a question box, so type away, and I will read it at the appropriate time. I can also open your microphone if you prefer to have a conversation, and you just have to raise your little virtual hand, and I will keep an eye on that, and you can ask a question that way. So Liz, let's go back to the conversations you and I and Sandy started on Wednesday night and again tonight about language. Language around the transgender community is super important. And so what would you want voice teachers who are just starting out with working with this community to know?
So I think one of the mindsets that we sometimes fall into is that the language around trans identities is changing and that it's like hard to keep up with, but I think that it's actually just becoming more accurate, and it's becoming a little more internally motivated or created. So now there are more trans people coming up with language rather than language coming from outside to describe trans identities and trans experiences. So now is a good time to reference that little handout because on the back of one of them there's a list of terms.
Yeah. And our chatters, you have a little box that says handout where we have uploaded the handout, so hopefully you can see that.
So the first item on the list is just the word transgender, and I think it's important to think of it or remember that it's an adjective. I always say if you're feeling confused about how to use the word transgender, replace it with the word squishy or bendy. So if you were talking about someone who is bendy, it would be an adjective. You wouldn't say like a bendy, and you wouldn't say bendies. You'd say a bendy person. And similarly, you wouldn't say that someone is bendied. Similarly, like just like you wouldn't say someone is transgendered. So you can replace it with any other adjective, or someone is squishy and not squishied, to remind yourself, I guess, how to use that word. And then similarly, cisgender is the same thing. It's just an adjective, just like transgender. I think more often folks misuse the word cis than they use the word trans, and it's just as important to make sure that that's used grammatically, I guess, appropriately. The other big thing that I want to get across or make sure to talk about is the sort of the points along the continuum of gender and how we move through the world with gender. So there's on the list, there's gender identity, gender expression, and gender perception. And those are 3 points that all of us experience around our own genders. So gender identity is simply like how I feel about my gender. Whether I know myself to be a man or a woman or both or neither or somewhere in between or kind of fluctuating between. Gender expression is how I show that on the outside. So that might be like what I choose to wear, if I wear makeup or not, how long I keep my hair, how I use my voice, how I gesticulate, general behaviors in between people. Those are all ways of expressing gender within our sort of societal norms of what those look like. And then gender perception is sort of how the world sees me through my gender expression. So in using a particular vocal style, someone might hear me and categorize my voice into a gender box. Whether or not that is reflective of my gender identity is kind of the part of the conversation that we're talking about now. So in our work, we help folks, I think, align their gender identity and the perception that they get from people around them through the way they express their gender with their voice. And I think especially the work that speech paths do and voice coaches do or speech coaches do is extremely poignant with that, because it's day to day. It's how you move through the world every day with your voice. And the attempt, I think, is to concretize and really delineate how I want to express my identity with my voice, and then experimenting with like how that's perceived by people around us. So that's mostly what I wanted to say about it. And then I guess the other little thing is that some of the language is shifting away from talking about binary trans identities as from one to the other. So Sandy and Kari and I were just talking about this the other day, where terms like F to M or female to male are kind of going out of fashion because they imply that someone is going from something to something else where they were already that thing before, if that makes sense. So rather than saying like a female to male person, you would say a trans man or a trans masculine person. So that's what I wanted to say about that. But happy to answer questions if somebody's got them.
And most importantly, it is that if a trans singer walks into your door, you have the conversation, you allow them to lead the conversation, I think is the most important, giving a safe place to have the conversation.
Yeah, I think
Emerald, sorry, go ahead, Liz.
The first question I think that we probably ask somebody who walks into our door is, how do you feel about your voice? How do you feel that your voice expresses your gender identity? Is that something that's really important to you? How can we shift from where you are now to where you want to be?
Mm-hmm. And I think...
Emerald, go ahead, Sandy.
And I think that it's important to also have the conversation about how do you feel about your voice, how do you feel about how other people feel about your voice. Because, I mean, we haven't, sadly, yet evolved to the point, and we probably won't necessarily in our lifetimes, from a sort of neurological standpoint, where the auditory cortex isn't still trying to categorize in some way. And so those two pieces of the conversation is, you know, how do you feel about your voice? How do you feel about how other people feel about your voice? Where are you on the spectrum in terms of your level of concern about whether auditory cortices are categorizing or not, and what does that all mean in the conversation? And that, you know, it's from a neurological standpoint, that starts to get very interesting and very difficult. So taking the lead from our clients is so important in terms of where they are with all of this very complex ball of wax.
Emerald, what would you like to add to this aspect of language? And
honestly, for me, I'm coming from purely a voice teacher's standpoint, and really just understanding how language can affirm your students and what you need to do. Voice lessons are an intimate, vulnerable place for anyone. And when someone's coming to you and maybe they have faced more difficulties in their life than a lot of people have, we need to create a very safe, very affirming space for our students. And one of the first ways you can do that is by respecting, remembering, being consistent with name and pronoun. So I would say that's like one of the most important things off the bat, is to not, you know, not mess that up and really just be very affirming to your students.
Great. Well, hopefully that gives people a place to start. I see on social media a lot where people are asking questions about this, and they don't even know the basics of how to address someone, and so I think that's really important. Sandy, I want to take it to you for a minute, since you're the medical connection and as the speech language pathologist. So what would you want voice teachers to know in a broad spectrum around hormones? Of course, it's going to be one of the first conversations that we would have. What else? And please talk about hormones specifically, and then other aspects you would want us to know.
Right, right. Well, first of all, I just want to, acknowledge the fact that I'm not an endocrinologist. So, the first piece of information is that for trans women, estrogen does absolutely nothing to change the voice. There is no pitch rise from estrogen. Some people have reported the feeling that they are able to express in a gentler, softer way after they take estrogen, but there's absolutely nothing that changes at the vocal fold level, even though, as far as the cyclical research shows, Jean Abitbol, who you had on, I think it was last summer, was it? Was talking about the cyclical changes for singers estrogenetically. Of course, we know that, but there isn't any pitch change, and so they are starting from a masculine range and working towards a feminine range. And so the vocal health aspects that go with that, of course, people need to be addressing things in a very gentle and paced way, and making sure that all of the usual vocal health aspects are attended to: good hydration, no tension, easing in, and so forth. And then for trans men, the voice does drop with testosterone, and there's a very wide range of drop that occurs. I mean, anything from just really a few hertz to a whole octave sometimes. The research really is pointing in the direction of a much slower testosterone titration in order for people to develop a voice that is strong, with integrity, and healthy. One of the things that is probably a greater concern for trans men, I think, in terms of their singing, as well as just developing a voice with a good round resonance, is that often trans men want to chase their testosterone. They want their voice to be deeper, faster than the testosterone is producing for them. And so there is some tendency sometimes to press the voice a lot, to push it down lower than really where the optimal lower pitches are. And that can cause some muscle tension dysphonias that then sometimes have to be undone. I think ideally, of course, as with everything like this, singing teachers and speech pathologists would be working in team, and sometimes with an ENT as well, an ear, nose, and throat doctor, in order for those results to be really, really healthy, and for a sound to be developed with integrity and stability and consistency and sustainability as well. Would you agree, Liz and Emerald?
Absolutely.
Yeah.
I think most importantly, what is okay for our singing teachers to ask about? So as an SVS, I absolutely ask about hormones, right? And medications. There are things that I do ask about. What can we and should we not include on an intake form, let's say, for this particular community? Are we allowed to talk about hormones? And
well, I think it's very important that singing teachers, just as speech pathologists, know everything about what's going on with their students medically. It does affect how a lesson goes. It does affect how the voice is developing. It affects a trajectory of vocal learning. And for instance, with trans men, if you don't know about what their testosterone pacing is, you don't know whether it's a moving target, have they already completed. You need to know those things from both the standpoint of where they're going to end up from a register standpoint, as well as from a pitch range standpoint, but also from a standpoint of medically how stable the voice is and how stable the anatomy is. I think that it's important to know as much about your student and client as you can possibly know. I want to know, I do a full medical intake with my clients the way I do with any voice patient that I have. I want to know about their medications, hormone-wise as well as non-hormone-wise. I want to know about what their medical history is, their mental health history. I'm asking their question. I want to know questions about whether they have reflux, of course, because that's going to affect the speaking and singing voice, can affect it. Allergies. I ask a full range of questions medically. I also want to know if they smoke and drink alcohol and how much water they drink, whether they use recreational drugs. And I personally want to know a little bit about, from a trajectory standpoint, scheduling-wise, and where we're going to go, and whether we need to take any breaks, and logistically, I want to know if people have surgeries scheduled and so forth. And I'm very upfront with my clients about just saying, I'm going to ask you a whole bunch of questions. I want to get to know all of you before we start, because that's going to affect how I teach you and how you learn. And
I would think questions around gender reassignment surgery, that has nothing to do with the voice. That to me would be inappropriate and none of my business. When you talk about a full medical eval, you're referring to things that would impact the voice.
Well, I'm asking things about that would impact the voice, but I also want to know about things that are going to impact their ability to commit to the work for a period of time, so that I can give them some reasonable idea about how long things might take. I mean, if I know that they're going to be taking off 2 months in the middle of our work together, that's information that I want to know. I'm not asking them very intimately. I generally ask a sort of broad question like, any surgeries scheduled, just in terms of our schedule together. I don't ask them specifically what. However, it is important from the standpoint of working with transmasculine singers, if they're going to be having any chest reconstruction surgery, or whether they are using a binder or not. Those are things that are going to affect breath support. They're going to affect, range of motion, that may affect how their voice is functioning for a period of time while those things heal and they normalize into their new physicality. So those are important things to ask.
Would you also probably ask about
questions about gender confirmation surgery are not, I mean, they don't affect the voice, but they from my standpoint, they would affect the schedule. And so I ask just generally, are you having any surgeries, rather than tell me what surgeries you're going to have. Does that answer your question better, Kari?
Yes. Liz, go ahead, jump in.
Yeah, I think it's also probably useful to ask about like facial feminization surgery and voice surgery. I know we talked really briefly about that over the email, but yeah.
Yeah.
Useful
facial feminization surgery is a very important piece of information to have, because that is a huge, usually 12-hour surgery that completely and utterly changes the anatomy of the whole head and sometimes neck. And yes, it will affect the singing voice for a period of time.
Yeah, for me, I think in my intake form, I'm asking about hormones, especially if it's a person who is taking testosterone, that is really actively going to be affecting our voice lessons. But as far as surgeries go, for me, I usually don't ask about it. It'll come up if it needs to come up. If someone's going to have a surgery and they need a few months off of lessons, they're going to tell me about it, and that's fine. So I usually don't ask about that. Absolutely, chest surgeries or wearing a binder, that obviously affects things, but you, again, usually notice it. And so it's not something I'm asking about right off the bat. If I have a student who is, doing really high breathing, and I think it's probably because of that kinesthetic association with the binder, we'll talk about it, and we'll talk about how to deal with that. But I don't usually bring it up unless there's a reason to.
And in case somebody doesn't know what a binder is, would you?
Oh, a binder is just it's a thing that you can wear that compresses the breast tissue. So for trans men usually, or trans masculine people that want to have more of that kind of straight silhouette, they might wear this. It's just called a chest binder, and it compresses the breasts.
It's like a tank top. It's like a compression tank.
Like
Yeah.
I would think that would be a pretty strong consideration when you're teaching breathing for singing.
And I've noticed with almost all of my transmasculine students that wear binders, we do have to address it, because having that pressure there, that's just you breathe towards it. And so I have a lot of really high breathing, and we have to deal with that, and it's okay. It's something that, you know, if the person's aware of it, then they can make adjustments that direction, so it's not a problem for breathing to be wearing a binder. It's just something to be aware of.
So bottom line though, and Michelle Marquardt asked this, there aren't any questions that we cannot, are there questions that we cannot legally ask, or any HIPAA laws that we would be breaking, or for the independent private studio teacher?
Our independent private studio is bound by HIPAA laws?
And I follow them as an SBS.
Oh, yeah. I mean,
but in this case, that's the question. Is there anything that we legally can't ask?
I think Sandy would probably know the answer to that.
Yeah, I'm not aware.
You know, that's I don't have the WPATH companion document handy right now. I'd have to go through it. I mean, there are certain questions that I simply wouldn't ask that are completely irrelevant. I mean, questions, you know, about sexual orientation and those sorts of things are completely off the table. Obviously, why would you want to know about that anyway?
Okay.
I mean, I think it would be really inappropriate to ask somebody specifically if they're having, if they're going to be having gender confirmation surgery specific. That's why I was saying, you know, the questions about surgery at all are really just about, do you have anything planned in the near future, just so that I can have some sense of our scheduling together. I don't know if it's legally that you can't ask it, but I can't imagine why you would specifically ask that question.
Got it.
I think it would be uncomfortable for somebody to have you ask that question.
We also have a question from Zipporah asking to explain a little bit further what facial feminization surgery is.
Oh, right. Okay. I will do the best that I can, because it is so complicated. It really is. And it depends very much on what the individual has chosen to do. But let's start with the most complex. Some people decide to have their brow size changed, the hairline changed, the distance between the eyebrows changed, the distance between the bottom of the nose and the top of the lip changed, the size and shape of the jaw changed, the distance from the edge of the jaw down to the chin changed. I mean, some people basically have everything taken off, everything remade in order to change the structure of the skull to match the more typical feminine size and dimensions of a female skull. It is an incredibly complex surgery that as I said, 12, 14, sometimes 16 hours. And then everything's put back together again. The clients who come after facial feminization surgery, sometimes they're still very bruised. There's a lot of suturing that goes inside the mouth that's going to make it difficult to open wide, to spread, and there's a lot of numbness and tightness for many weeks afterwards. it's a major reconstructive surgery of the entire facial skull.
And I would think intubation considerations, of course.
I was going to say, yes, and the intubation considerations are huge. So, you know, I tell my clients who are having facial feminization surgery that they need to look their anesthesiologist in the eyes. I'm looking at you now. Smallest tube possible. Smallest tube possible. Smallest tube possible. I've been working on my voice. I love my voice. Smallest tube possible. And I get them to repeat it over and over again. And whatever lubrication you can use so that there is as little friction as possible and potential damage. I do have people that come back from FFS with very hoarse voices for a long time because the intubation, I mean, anybody who's intubated for that long, you know, has a potential for some pretty significant vocal changes for a period of time.
Forgive the self-plug, but I've written an article on intubation consideration for singers that sits on my website. So, in fact, Sandy, you were probably there when Dr. Murati inspired the article. He brought in those intubation tubes to one of our Voice Foundation meetings. And I thought...
Oh, that's right. Yes. Yes.
And I had an article written about a month later in collaboration with one of our ENT, local ENTs here, who happens to also be an anesthesiologist. So
right.
You can just hand that
even
and it talks about this.
When I had surgery myself, the anesthesiologist came to me and said, do you have any question? I said, no, I have a comment. And I did this with him. And the 3 times, he said, yeah. And we go, we do have to intubate. I said, no, this is my life. This is my life. I'm watching you.
And I have to say, you have to really take it seriously. I had 2 hip surgeries last year, and I went in with my article in hand because the ENT or the anesthesiologist who co-wrote my article with me was not available, or I would have used him. And they knew him. And even then, I have to say, I tried to be so gentle because I would not want somebody walking into my studio with an article on how to teach voice. Can you imagine? So I was as demure as I possibly could be with my little article in hand, and at 5 in the morning, and and even then she was a little resistant. And then right before we talked, and as we finished, she said, "Oh, give me your article. I've got 2 hours to kill," while I was having surgery, and she apparently read my article then.
Good.
But
good.
Yeah, but she was even, and when I shared that story with Dr. Murati, he said, can you imagine she was that resistant to you who have written this article? Can you imagine how other people feel? Anyway, we digressed down a little rabbit hole, but it was an interesting experience for me. Let's do this. I want to lead us with our time left. I'm really would want to encourage, first of all, for our chatters to ask questions. But let's move into the voice studio now. Let's, and I love this quote from Liz the other day where she says, teacher, we want to move our studios from a teacher-led studio to a student-led studio. And I'm not sure if that exactly fits as we go into the studio now, Liz, but I just thought that was so wonderful. And what you were really talking about is that the students lead us along this journey of them learning how to sing. Would you like to elaborate on that just a bit?
Sure. I think for many of us who grew up in the academic voice education world, we did not necessarily have a lot of say in what we studied. I think the audition experience, maybe we were assigned to a teacher and we were assigned the repertoire we were going to do and assigned the roles we were going to sing. And as we move into a more gender-inclusive studio, it's going to feel a little different. It's going to be a little more like maybe we get somebody in and we say, what do you want to sing? And then we try to support their goals, which I think is a really different experience than what we had growing up. And one of the things that I think we get to start to do in kind of moving this idea forward is detach singing identity from gender identity. that they can coexist and exist alongside each other, but that they don't have to be inherently linked. So when we're thinking about choosing rep, when we're thinking about guiding somebody toward freedom in making sound, that it can be sort of liberated from gender, that we can let them guide us in how they want to sound and give them tools to do so in a really healthy and supportive way. So I think this is just a very new way of thinking about it that many of us didn't grow up with, that our students are the ones leading us rather than the other way around.
Wonderful. So let me, I'm going to open up the mic of my dear friend and colleague, David Sabella. David, hang on. Let me open it up here. Unmute you. David, are you with us?
Yes, I think I am.
Yes, we hear you. Welcome. Hi, friend.
Thank you all. I had a couple of questions and observations. I have had the honor of working with a few trans singers in my career as a teacher. I am the proud father of a daughter who is lesbian, and I myself am gay, and so she's very connected into the community, the young teenager community. So at any given evening, I will have several trans teenagers in my house, you know. And one of the first things I always ask is, what are your preferred pronouns? And Liz, I want to thank you because that's the first thing you said. And I think it needs to become a norm. I think we can't just assume that because someone looks a certain way or we perceive them to be on a certain journey of what their pronouns might be. The they and them is a new pronoun to me, and there are many others that I am still learning. So I really appreciate you saying that. So thank you. Some of my questions revolve around the specifics of working with trans singers. I have had the experience of working with trans females, and the binding is an issue, and I honestly, it's very hard to, I'm trying to get them to expand their rib cage, and suddenly they're completely bound to that. And so I haven't brought up the possibility of, do you feel comfortable enough to loosen the bind, or is that even something I should consider talking to them about, and if not, how to teach breathing so that they can get that full expansive breath. That's one question. And then the second thing is, the common denominator of all these students, whether they are trans or not, is that everyone comes into the studio somewhat unhappy with how they are sounding and wanting to sound like something else. That's the common denominator of everybody, right? And so they're looking to improve their voice. The specifics of a trans person, in my experience, is that they place somewhat unreasonable deadlines on themselves and maybe unreasonable expectations. We've addressed a few of them in the panel today about, trans men wanting to push their voice lower than is the optimal pitch. Trans women wanting, and specifically coming to me, I was a countertenor in my professional career, so they come to me wanting to develop their falsetto and to gain higher inflections in their voice. And I honestly don't know of the time frame, the timeline. I wonder if there's any research on the efficacy of working with these singers to raise their optimum pitch and or change their optimum pitch. Sandy, you said it was based upon a timeline of hormones. That is fascinating to me. I don't get to know that information from the singer. So there are real sort of nuts and bolts every day in the studio questions and concerns that I have that I would love for you all to address in that way.
Can I jump in here just to dispel? It sounds like you may have misunderstood. I may have said something in a way that led you to misunderstand something about the hormones. The research, for instance, Alex Constanzis's research, and I'm blanking out right now on the other people, but there is a fair amount of research specifically for the pacing of testosterone for trans men in order for the voice to stabilize more sustainably, but it's not specific to a timeline of when they might be able to develop a good singing voice. It's
Right. Am I still on?
Did I understand your comment accurately?
I think so, yes, because one of the things that I'm very wary of with all of my students, male or female or any student at all, is, not to have them press their voice past lower than their optimal pitch,
Right.
But it is a sort of moving target, as you have sort of stated, and
Yeah.
wonder if there is a guideline for singers to know, I've always just been led by the singer's voice. One day it'll be a half step a little lower. Okay, let's explore that. But is there a guideline or anything documented that can give us more of a guideline as for how and when to deal with these issues?
I'm going to let my singing colleagues address your comment, but I have a comment about expectations about voice in general that I want to make at the end of what they've said about the singing piece.
Great.
So if you want to answer any of the other questions, I have comments about the binders and breathing and teaching that, but if that can wait until after the timeline questions. Okay. Well, as far as the timeline questions go for me, though, briefly, every voice is different and every person's transition is different. So I really think that there's not an actual answer to that question. In my experience because again, with trans women, the voices don't change with the hormones. They don't affect the voice. But with trans men or trans masculine people, they do. And in my experience, 3 months to a year tends to be the really kind of the real fun part, and where you never know, come into lesson and everything might be totally fine, and then next week we have a whole third just missing, and it's just a time of a lot of instability, and it legitimately lasts. The first 3 months to a year is really rocky, and then in my experience with my students, it does start to stabilize a bit after that, but it could take a couple of years. And every body is different, every transition is different, so I don't think you can't really pin it down. So that's just one of those, beauty of every human being different kind of things. As far as chest binding goes and teaching breathing with that, I found just having an awareness of it, knowing the reason that we're having trouble kind of expanding, or not expanding, obviously we have constriction here, but there is a kinesthetic association here, and so getting that lower breathing is just, you have to be aware of it. As far as asking to loosen or not wear a binder, I think that's out entirely. If someone, in order to have the presentation that they feel that they identify most with, needs to have the silhouette that involves a binder, then that's that, and we as voice teachers need to respect that. People have been singing with some kind of ribcage constriction for hundreds of years. It's totally possible. So it's not really different with binders. For me, I like to do kind of exercises where I have them lean forward and really feel the space they have and back, and feel the ability to really expand with that binder, and just get that feeling when they're not singing. Just breathe into the space, and think about breathing a little bit lower, and with time it seems to work.
So to kind of piggyback on the back of that, I completely agree that straight up asking your student to loosen the binder or take off the binder is absolutely inappropriate. The amount of anxiety that someone has to overcome just to be in the lesson studio with you is so high that it might be too much. It might be too much to ask for that. One of the pieces of language that I try to encourage us to use, just going back to this idea of like student-led lessons, is the phrase, what would it be like to? So when we're talking about feeling sensations in the body, because again, dysphoria is such a blinding scenario, or such a blinding feeling to be in, even just asking someone like, hey, why did you breathe into your belly, or whatever, can be an enormous ask. And we take that for granted, again, because in our educational lives, it wasn't that uncommon. It wasn't a huge deal for someone to say, like, you know, try opening up this part of your body, or try feeling or being aware of this part of your body. But for somebody who's experiencing dysphoria, certainly someone who's experiencing dysphoria to the extent that they need to wear a body-shaping garment, asking them to feel their bodies is a really big thing. So I like to use the phrase, what would it be like to, before asking for anything. What would it be like to sing in front of the mirror? What would it be like to feel your breath in your back? What would it be like to try this other part of your range, or whatever? So that you're giving agency and autonomy to the student, which is especially poignant in a trans person's life, where agency and autonomy are hard to come by. So that's an opportunity that we can give to our students to really take ownership over their voice. Going back to expectations, you know, like both of y'all have already said, everybody is different, and I think it's important to identify the reasons behind someone's goals for their voice. So if you've got somebody who wants to come in and extend their range in some direction or other, like I usually try to ask them, you know, why is that important to you? What does that mean for you to be able to sing in a different range? And if it's not something that is, you know, physically feasible at the time, like what are some other things that we can do that will help you find that style of voice? Like if the concern is that you want a feminine voice or you want a masculine voice, or something, I guess that's more like perceived feminine or perceived masculine, then maybe if we can't quite get the range, like maybe let's talk about articulation, maybe let's talk about resonance, maybe let's talk about how to get a timbre that feels more natural and authentic to you, even if getting up to that, you know, high note isn't feasible right now. And then you can kind of maneuver through those different parts and manage expectations while you're still fulfilling your students' goals within, you know, healthy limitations. And then the last on timelines. So there are like little tiny like nuggets of information, like Constance's work in Sandy's book. There's some information about voice change and timelines and habitual speaking ranges over time. And in the Singing Teacher's Guide, the book that's coming out, we have I want to say like 6 or 8 different students, and we kind of tracked their voice ranges over several months. Some of whom go from no T, like pre-T, to 12 months out. Some of them are starting at 8 months on T to 24 months out. So there are no strict guidelines, but we are starting slowly to assemble just information that you can kind of utilize as a way to show your student, like, here are some other singers who are going through a similar thing, and here's what they did. I definitely, in Constance's article, there's like a graph at the end that shows his change of voice range over time, and I like to give that to my transmasculine students when they're feeling like unsure, when they're at that point, that 6-month point where they're like, what is happening with my voice? Then it's helpful for them to see, like, okay, here's someone else, you know, who's kind of gone through the same thing, and here's what you can, I don't know, start to think about, not necessarily expect, but start to think about. So there's, you know, we're getting there slowly.
I think one thing just to point out with this is, I know Sandy and Kari will remember from the voice conference, the Northwest Voice Conference, Aaron's presentation and his study that indicates that there is actually a pretty significant portion of people who take testosterone who don't have any lowering of the voice. And so I think that's actually important for people that are doing this if they're expecting some big change, that if that happens, that's really great, but there is a chance that you won't experience a voice change. And I think having that be something that, at least especially, you know, as a voice teacher, that's a possibility too.
With our clock running down, I want to move into follow up with a question that Barbara Martin has asked about exercise, singing exercises. Isn't that always what voice teachers want to know? And so I always say there are no magic exercises, but what are some parameters that you can give us in just a couple minutes soundbite? And very specifically, she has asked, for example, in trans women, do you still work with the lower voice? I have been told just to exercise the higher voice, but I don't think that is complete.
I think it depends on the student. I think you ask, what would it be like to sing in your lower range? What would it be like to sing in your higher range? I think it's hard for us to ignore whole parts of the voice. At the same time, I think we have a responsibility to help our clients manage their dysphoria about their voice in the moment and offer them opportunities to choose to do something or not do something.
I feel the same way. Again, as a voice teacher, I like to work the whole voice. I think that's a good way to do it. But again, if you have a student that has dysphoria and that is, it's going to affect them really severely to be using the lower part of their voice, then don't do it. I had one student who she said that she was comfortable with it, and she was a really great ear. She had done a lot of singing and a lot of playing instruments in her life, and she would be perfectly in tune, really beautiful sound in her high range, and as soon as we would get into her low voice at all, couldn't match pitch. Nothing. And she had said that she was comfortable with it, but she wasn't. She clearly wasn't. And then maybe about 8 months later, we worked down. She said she thought she was ready, and we did, and everything was fine again. So she just needed to get comfortable with it. But it's up to the student. We need to serve the student first.
Two broad takeaways, right, from that conversation are A, let the student lead you by asking what they're are comfortable with, and then allow for the time that there's going to be a period of adjustment as they explore, and helping them to be comfortable with that.
Yeah. I think it's important for people to really understand how much we don't understand about what it feels like to be dysphoric. I mean, those of us who don't experience that can't possibly walk in those shoes. And I think going back to what Liz, you've said several times, and we've all been in agreement with, we absolutely have to let our students and our clients lead. We can't force anything on them. We shouldn't force anything on them. We need to just say, how can I serve you? How can I best serve you?
Well, we have just a couple questions that, as we're close to the end of our time, I would like to at least try and talk about this. We have a speech-language pathologist, Rebecca Jamieson, who has joined us from Melbourne, Australia. And she says that I feel that voice therapy and achieving optimal speech and/or singing voice can be achieved more effectively when skills are shared between singing teachers and SLPs. This is still controversial where she is from, and some are strictly against it. And in your opinion, where should transdisciplinary practice versus multidisciplinary practice in working with transitioning voices be used? Sandy, would you like to
talk about that one?
That's like a whole weeks-long conversation in itself.
I think that it is so important for people who have an expertise in voice across disciplines to share their experiences. I think it's very important for us to get together across disciplines and say, what works for you, this is what works for us, and this is the science behind what we do, and what is the science behind what you do? Why do you choose to do it this way, and why has it worked? And this is what has worked for us, and this is why we're doing it this way. I take information from my singing background all the time and blend it with my clinical background. I think that the takeaway for my clients is so different from client to client, and I'm constantly pulling across disciplines, but that's because I have those disciplines and I've trained in both of those disciplines. And I think that the more we can train each other across those disciplines, the more we have to offer clients. Everybody learns in a different way, and everybody needs something different to get to where they want to go, speaking or singing wise. And I think it's really important for us to share our expertise as long as it's based in evidence.
Wonderful. Michelle, Michelle Marquardt asked the perfect question to bring us to a close. If we are interested in working with trans community more, how do we make ourselves known to the community in a help with, not show how way?
Do it for free.
No, seriously, when I was doing my dissertation, that's what I'm trying to figure this out. I want to help you, you help me, we do this together. And I, again, had 13 private students in a class, pretty quickly. So, yeah, absolutely.
I think, and I think so that also makes me think of Leah. So Leah, I love Leah's philosophy about this, that we are all experts and we deserve to be paid for our expertise. And financial barriers are significant for trans folks seeking any kind of care, especially voice care. So one of the things that I like to do is just go to as many places as I can where trans and queer folks gather and just offer workshops. Like in Chicago, we have a pretty vibrant and vast community of queer folk, and so I go to like the queer clinics and just offer to give voice workshops. I give workshops to folks who are working in complementary fields. Like I meet with a lot of therapists, and I meet with a lot of folks who we probably share clients and offer them information about voice that they can give to somebody else. And then the referral is coming from a trusted resource which can help kind of guide that client to you in a way that's helpful and not salesy.
Right.
I found also there's, again, usually if there's a LGBT choral group or something like that in the area, reaching out to the conductor and letting them know is a good way.
It's wonderful.
And in my case, presenting at conferences, teaching classes for free, going to, I'm a part of the Ingersoll Consult group here, which is the LGBTQ plus group that meets every other month, many different kinds of providers. I've just been invited to speak to a group of doctors. Go listen, and say, how can I help you? Versus, here's what I do.
Well, I can see that we need a part 2 where we talk more about specific singing aspects, approaches. I thought that's where the conversation would head, but one of the things I love about NATS chats is that they evolve in the way that they are supposed to. And I think tonight is an example of that. I want to remind our NATS chatters about our Las Vegas NATS conference in June, and Liz will be presenting at that as well, so you'll have an opportunity to hear from her a bit more. And also in January, our NATS chat will be January 14th. It'll be at a different time at 12:30 the West Coast and 3:30 on the East Coast, because the very accomplished Janice Chapman will be joining us from England. So please mark that on your calendars. And I just cannot thank my guests enough, Sandy, Liz, and Emerald. Thank you so much for your expertise. I know that we barely scratched the surface of really important topic tonight. So thank you so much for being here.
Sorry.
Yeah, my pleasure. This will be continued, and we're getting lots of NATS chatters thanking all 3 of you for your expertise tonight. So wishing all of our NATS chatters a happy holidays and have a great evening. Guests, if you'll stay on for just a minute.